We are Team 9. We're focusing on the Good Medical Practice Survey. Who should we ask and how should we do it? Okay, go.
Okay, as you can see from this splendid poster that Ann has put together, we discussed the purpose of the survey and briefly had some agreement on that, determined the level of agreement on the bullets that we've selected, and to validate the descriptions. Try, in other words, to move to a more common meaning and language. But when we came to discuss the steps, there was a great deal of discussion about the scope and breadth of the survey itself. And we've concluded that it would be best to begin with those professionals that are internal to the profession itself, such as practicing physicians, patients, and residents. That is to say, those who actually have one-on-one patient contact as being the number one primary purpose to begin. And then once that's done and we're comfortable with that, we could proceed to the health professions team and with the focus there being a view of what is appropriate for physicians. Other considerations in this category include the purchasers of medical services, such as employers, insurers, and payers, and care settings, of course, like hospitals, clinics, and long-term care. My collaborator will now discuss how we might select.
The way to select would be to select cohorts, cross-sectional structured, and use professional polling groups like Consumers Union, AARP. Certifying boards would serve as resources. Focus groups is another method, especially to try and pick up missing areas and gaps.
We thought that it might be necessary to motivate individuals to take the survey, and we thought that a small amount of money might be a good idea, or perhaps a donation to the charity of choice. Or another suggestion was made that a lottery for a prize if someone participates might be the way to go.
And we talked about how we might use the results when we have them. It might help us to focus on deciding what should be included or excluded from the Good Medical Practice document. We need to decide who decides what is the final version that goes out as a new version of GMP. This process could easily identify tensions within the profession or between the profession and patients and encourage the difficult but necessary discussions about those tensions. We might use the results to edit and improve GMP through an editorial committee and volunteers, leading to new versions and perhaps repeating the survey as we continually refine this living document.
I think that's perfect.
Should be more than 2 minutes.
It won't stop.
Oh, you got that on there. It won't stop.
It's still going. How do you stop the thing?